Heavy menstrual bleeding is a common problem that women suffers. It is quoted that the incidence is roughly around 24 to 52%. Now, the reason it is important to identify this because it could be a sign of hormonal imbalance. As we all know that naturally you have two hormones, which is the estrogen and progesterone, that control the cycles. However, there is also above the ovaries, this system is covered or is controlled by hypothalamic-pituitary axis and the ovary together. When there is an imbalance in the production of these hormones, the cycles may vary, leading to abnormal uterine bleeding. And that is what is presented as heavy menstrual bleeding. So what it indicates is not just structural problems, but also the functionality of the womb as well as the hypothalamic pituitary axis. And that dysfunction leads to the problem called heavy menstrual bleeding. So it can start, there are a wide range of causes for heavy menstrual bleeding. We say that it could be local causes. So if it is a problem in the lining of the womb, like you could have a coil that could lead to heavy menstrual bleeding, or polyp, fibroid, conditions like adenomyosis. There could be other precancerous cells, abnormality, as well as abnormality in the womb in the form of anything like womb cancer. That is a remote cause. Then going to the ovaries, you could have conditions like polycystic ovarian syndrome that could have irregular and heavy bleeding. There are other conditions that could cause heavy menstrual bleeding where it affects the hypothalamic pituitary axis, and that could be from any problems with the pituitary or with hypothalamus function, with loss of weight, excessive exercise, and anything, and stress even can affect how this hypothalamic system works. Medications like being on tamoxifen, taking hormonal pills, or having coil can influence how the periods are. Systemic causes could be renal conditions, liver conditions, there could be thyroid conditions, and bleeding disorders like von Willebrand can affect how the bleeding pattern can present. So it is something that we always say to our patients that when you have heavy menstrual bleeding, it is usually when it affects your quality of life, you're unable to function your day-to-day activity, that is where you need to be investigated. Any change in the normal pattern that you've been experiencing, then you need to report, because that's where we need to check that everything is fine. Why that change has happened is what we want to investigate. Also, when someone develops symptoms of anemia, like being generally tired, have palpitation, feeling dizzy, and having unable to stand and function normally, could be signs of systemic effects like anemia. And also, there are red flag symptoms, like if your period changes in its pattern and you start developing intermenstrual bleeding or postcoital bleeding or prolonged bleeding or bleeding where it becomes very irregular, then there is a change in your body, and we need to identify what that change is, because remotely we want to exclude any high-grade abnormality like cancers. So what we always, as you always have heard, that early identification and investigation and detection is important. There is a common saying that good health and good sense are the two great blessings. So we have to understand how our body functions. It's important we identify that there is a change in the pattern. As I have said, any change in the type of the bleeding warrants investigation. And when you feel that you're not yourself and it affects your normal day-to-day function, then it's important to be investigated to rule out any problem, even benign conditions or remotely anything worrying. That's what we are there for, and that's what you need to have these investigations. So early detection is possible, early treatment is possible, and rectifying the abnormality is possible.